and we're using a K3 needle which is insulated. In exceptional circumstances of very severe nickel allergy, it is possible to use a gold needle. You must remember, however, that the gold needle is not insulated, and the attention to detail, particularly of the insertion of the needle at 90 degrees to the skin surface, is very important, so that no arcing occurs on the skin. In my experience, the majority of people, even with severe nickel allergy, can still be used with the nickel needle, because the amount of time that the current is going through the skin is only 0.2 of a second. So the risk of reaction is very, very small. If you want to increase the heat, which you may do in some very difficult veins or large veins, rather than turning the heat up on the machine, you can decrease the size of the needle and use a K2. At no time should a K6 needle ever be used. This video is actually showing the rate at which veins are cleared, and this is standard practice in my clinic at the present time. As you can see, these large veins are cleared really very swiftly. Again here, taking the side of the vein first, narrowing the lumen and then hitting it in the center. Years ago, veins like this were often treated with injection, and injections for veins like this on the face should never really be used. Diathermy has no place in the treatment of veins like this. Get a small hemorrhage, just hit it again and it'll stop, or put a small piece of gauze on it for a few minutes. Intranasal veins are, of course, very vascular. Clearance rate using this technique is in the order of 90% of the veins visible using polarized light. This technique's been particularly useful in eradicating spider nevi of all sizes, and spider nevi all over the body, and not only in adults but also for spider nevi in children. The technique's the same. We start at the periphery of the spider, run along the limbs, and then hit the central vein. This particular patient on this training video has got multiple spider nevi which have been caused by alcohol. Occasionally you get a little bit of subepidermal edema on the face, lasting about an hour when you treat alcoholic spiders. There's a very nice example, starting at the side, hitting the center, and they just disappear. The recurrence rate with spider nevi, interestingly, is in the region of about 20%. This is usually due to the fact that they are fed from deep vessels which you can't identify using surface visualization. They nearly all go at a second attempt if you need to do them. If they do recur, they'll recur within about 4 to 6 weeks, and no attempt should be made to redo them for a few months to enable any revascularization to occur properly. Spider nevi can be treated on the face without any anesthesia, and even in children I don't use any analgesics. The youngest that I've treated is 5, and I think this is a reasonable age to treat children if you need to. This film shows quite clearly how quickly these can be treated and how minimal the tissue reaction is immediately after the treatment. Apart from mild pallor, there should be no other skin discoloration. There are some techniques which use electrocautery or the wrong settings for their machines, which do in fact cause skin burning. That has never ever been seen with VEINWAVE. This shows a little bit of subepidermal edema, and this settles down if you should get it within half an hour to an hour. Now, VEINWAVE can be used to treat the telangiectatic small blood vessels on the eyelid. This gives you some idea of how minimally invasive the treatment is and how little trauma there is in this very delicate area of the body. It's very important when treating this that you don't go past the line of the lacrimal duct. Again, the settings are the same that we use elsewhere on the face of 40 and 0.2. Now, this treatment here of telangiectasia on the legs, and these are typical telangiectatic vessels, and with these we always start again, as we do on the face, with the peripheral blood vessels to slow the flow down first of all, and then for veins that are a little bit bigger we leave those to the end, and some of these we would treat using VEINWAVE and some we would treat by sclerotherapy. The rule generally in the clinics and with the doctors that have been trained in the UK and in Europe is that VEINWAVE is exceptionally good for veins up to 0.3 of a millimeter in size, and for veins that are larger, in other words if you can get a needle into the vein, we would treat it by sclerotherapy. VEINWAVE is always done prior to sclerotherapy, and by using that technique we decrease dramatically the incidence of matting. It's normal practice to wait 4 to 6 weeks after the VEINWAVE treatment before suggesting either a second VEINWAVE treatment or for injecting. Again, there's no preparation of the skin prior to this treatment and no particular aftercare. However, it's very important to tell patients what the appearance of the skin will be after the VEINWAVE treatment on the legs. Immediately afterwards, the vein disappears, as you can see here in the video. Within 10 or 15 minutes of starting the treatment, they develop some subepidermal edema, and the picture looks a little bit like a mosquito bite. And the mosquito bite look will last for about half an hour, then disappear. Then nothing is then visible for usually a couple of days. Then the area where the vein's been destroyed, so in this video we're destroying several centimeters of vein, the body absorbs the dead vein wall, and there is an inflammatory reaction which looks like either micro scratches or like a cat scratch. It's also darker than when the patient initially started. That picture will last for 4 to 6 weeks, but it always settles down. This shows the slight edema and the mosquito bite look immediately after the treatment. It's not necessary to put any cream on this. It doesn't hurt. Most patient sensation is maybe of a little bit of heat. The use of VEINWAVE in the UK has now been well established, and it is in fact the first line of treatment for all telangiectasia on the face, and particularly around and inside the nose. In combination with sclerotherapy on the legs, it's now the gold standard for the management of telangiectatic vessels.